As Omicron wanes, people are wondering, what is the state of the pandemic?
FDA advisors will meet tomorrow to hash out what the future of COVID boosters will look like this fall.
Today, CDC Director Dr. Rochelle Walensky said you don't need a second booster if you've been recently infected with COVID. UW Health's Chief Quality Officer, Dr. Pothof, is back with us for his Tuesday visit. Welcome back.
Hi, Dr. Pothof. Good to see you
guys.
We don't know how long the immunity lasts if you had the Omicron.
Right, there's a few things with COVID natural immunity that we don't know. So one, it's a bit variable on who's going to develop a robust immune response and who may not. And there's really no way to know that. And then immunity can be somewhat variable as far as duration. 2-3 months for sure, that's probably safe to assume. After that, it could wane. So it's not as reliable as, say, vaccine-induced immunity, where we've got good data on, how well do you do, how long does it last, what does it protect against. It's a little bit more uncertain.
There's a little bit of ambivalence and some questions remaining around the second booster. I was just having this debate with my very own parents, trying to decide, should we get it? When should we get it? Help us clarify who needs a second booster and why you should get it. Make the case for it.
Yeah, I think there is more nuance around this time. Now, the easy answer is if you're over 50, the risk of it is tiny. The benefit is probably anywhere from, really good for those 65 and older to, maybe okay for 50 to 65. I think that the way that I always look at it is there's good data from Israel that says if you're over the age of 65 and you get boosted, if you come in contact with Omicron, your chance of severe disease much lower. We don't have a lot of good data between 50 and 65. Probably closer to 65, it makes sense. Closer to 50, that initial booster that you got, maybe that protects you adequately against severe disease. But now let's say maybe I'm, obese and I have COPD and I can't breathe very good at baseline and I'm 55. Well, now maybe I get that booster because if I were to get Omicron, my chance of doing worse is higher. So I think between the age 50 and 65, never a bad idea to get the booster. If you're wondering about it, talk to your doctor about it, about what are my risks, what should I do. For those of us younger than 50, the current data with that single booster would suggest that we might get symptoms if we come in contact with Omicron, but we're probably not going to get really sick.
So this 66-year-old guy got his shot on Saturday, and I'm sitting there going, am I going to have to do this every 4 months?
I think eventually no. I think right now we have, it feels good in the U.S. We're not seeing a lot of COVID cases. It feels like this is kind of over. Other parts of the world, there's still a lot of COVID. There's still a lot of the world that's not vaccinated. We're still seeing these variants creep up. And that's one of the drivers for these more frequent vaccination schedules is we're seeing these variants come at a little bit faster clip than we typically would. Fast forward to an endemic state where we're not seeing these variants develop quite as quickly. We all have some baseline immunity because either we got COVID or we've been vaccinated against it. I think you see that frequency of boosters drop down. Maybe it's like the flu where it's once a year, but I don't see a forever of every 4 months we got to go get a shot.
The COVID restrictions here are pretty much over. Everybody is essentially moving forward like it's done. We're, our COVID fatigue has set in.
What happened the last 2 years?
Right, exactly. We've just kind of, are we in a false sense of...
I don't know if it's false sense. I think right now things do look pretty good. We're not seeing a lot of new cases, or at least not an escalation of cases. Hospitalizations are low. I think, it's not to say that we couldn't have something happen that makes us have to go back a little bit. Nothing on the horizon that tells me that's what we have to do, but there may be instances where we do need to grab our masks. The best thing we can do to prevent that scenario, though, is to make sure that you're vaccinated and at least have that first booster dose. Because then if there is a variant, we might have some symptoms, but we're not going to get so sick that we fill up hospitals. It's not going to create a big stress on society.
Do you think it's safe to travel to Europe and other places this summer, other parts of the world that aren't being as successful with this as we are?
I would look at case levels, and then if you are going to travel to those areas that have high cases, you're going to want to take some protections. You're going to make sure you're vaccinated. You want to take your mask along. Maybe you get tested when you come back, but I don't think I'd completely cross off travel to some of those places.
One day at a time.
Yeah.
All right, doctor, see you next week.
Sounds
good to see you. Thank you so much.